afternoon, everyone. I'm Dr. Abhirup Banerjee, consultant endocrinologist, currently at NRS Medical College. So today I'm going to discuss about the hypertension. So what is hypertension? If you want to describe it very briefly, that it means a raised blood pressure. So we have basically two type of blood pressure, that is systolic blood pressure and diastolic blood pressure. If our blood pressure raises than the upper limit of normal, then it should be called as hypertension. Our normal BP should be within 130 by 180. Any rise in BP above that can be considered as pre-hypertension. A systolic BP of more than 140 and a diastolic BP of more than 90 should be considered as hypertension. Now, this hypertension can be due to multiple causes. It can affect people from any age group, though it's most common in elderly patients. So, but it can affect any age group. So if you want to list out the causes of hypertension, then it can be essential or primary hypertension or secondary hypertension. Now, coming to the secondary hypertensions, they are very rare. They are not so common. If we want to know the causes of secondary hypertension, then first and foremost thing we need to know some vascular pathologies like renal artery stenosis, coarctation of aorta. If we apart from this, few endocrine causes like hyperthyroidism, Cushing disease, acromegaly or growth hormone excess, that can be associated with hypertension. Mineralocorticoid excess syndrome or Conn syndrome, that might be a cause of hypertension, and pheochromocytoma. That can release, the tumor mass can release. This is basically an endocrine tumor which might release epinephrine and non-epinephrine, which might cause hypertension. Several other causes of hypertension are there also, like hypercalcemia can also cause hypertension. Obstructive sleep apnea can cause hypertension. So all these are the secondary causes. Now, most of the hypertensive patients, first and foremost thing which we should advise, that is dietary and lifestyle modification. I'm getting back to this later on. So the most common variant we frequently encounter, that is essential hypertension. Now, the essential hypertension is related to our sympathetic overactivity and age-related vascular atherosclerosis. So what are the important risk factors for hypertension? Essential hypertension, that is age, family history of hypertension, sex of the patient, smoking history, and other lifestyle parameters like sedentary lifestyle and obesity. So these are the risk factors which are associated with hypertension. Now, hypertension, what is the problem with hypertension? Now, this hypertension might lead to cardiac remodeling, left ventricular hypertrophy, diastolic dysfunction, later on coronary artery disease, and heart failure. It can cause cerebrovascular accident, which we commonly say or identify as stroke. It can affect our renal system. It can cause chronic kidney disease, whereas chronic kidney disease can also be a cause of hypertension. And there are two things, that is hypertensive urgency and emergency, that is associated with excessive rise of blood pressure leading to target organ damage. That means hypertensive retinopathy, hypertensive nephropathy. So these are the complications with hypertension. So we have to consider it. We have to consider it as a very serious and severe clinical threat and need to treat it accordingly. So before treating the patient, few investigations we need to do for hypertension. The most important, we should go for a complete hemogram, thyroid profile, fasting and plasma blood sugar, lipid profile, thyroid profile, urine ACR, and creatinine value. So, and also ECG and echo if it is needed. So these are the basic investigations we should do before treating the patient. So after diagnosing the hypertension, first thing we need to advise, that is dietary modification and exercise. DASH diet that should be followed, which is rich in fruits, and the sodium intake should be total sodium chloride intake should be less than 5 grams per day. That means total salt intake should be less than 5 grams per day. We have to reduce the trans fatty acid from our diet. We need to reduce overall cholesterol intake from our diet. We need to increase the consumption of more carbohydrates and fruits in our diet. So this is basically DASH diet we should advise to our patient. Apart from this, physical activity is also important, and that should be 30 to 45 minutes of moderate aerobic exercise for us, that is which we can commonly do, that is brisk walking, that can be divided into 2 or 3 sessions and should be done at least 5 days per week. After dietary and lifestyle modification, we have some pharmaceutical management options for hypertension also. In younger patients, angiotensin receptor blockers like telmisartan, valsartan, dosartan, these are our options that can be used for hypertension. Apart from this, for elderly population, calcium channel blockers like amlodipine, cilnidipine, these drugs can be used to reduce hypertension. When a single monotherapy fails to control the blood pressure level, then we might think about our second drug. We need to add, if the patient is already getting ARBs or ACEs, that means ramipril or captopril, enalapril, then we need to add one calcium channel blocker. If the patient is already receiving calcium channel blocker, then need to add one ARB or ACEI. We need to evaluate the patient after 3 months. We need to gradually uptitrate the dose, and that dose should be the maximum and the most tolerable dose that should be given. And patient should be on that maximum tolerable dose for at least 3 months. And then we need to add our third molecule, which diuretics are there. That can be a loop diuretics or thiazide diuretics. So thiazide diuretics are better option than loop diuretics to control hypertension. The third line of therapy should be a thiazide diuretics. And if it is still not controlled, then we should think about resistant or refractory hypertension. In these patients, we need to evaluate the patient thoroughly, and we need to identify the secondary causes of hypertension that I have already mentioned. We need to evaluate the patient and investigate the patient. If any secondary cause is found, then we need to treat. And not only that, as it is a chronic disease, so compliance is a bigger issue. So we need to address the compliance also. We need to take a thorough history from the patients regarding their drug compliance. We have to think about the dosing. We have to think about side effect and the separation of the dosing of different molecules. And thereafter, we have as fourth line, we can add mineralocorticoid receptor antagonists like spironolactone. Apart from this, if the patients are already having renal disease or hyperkalemia, then mineralocorticoid receptor agonists are contraindicated. In these patients, we can think about alpha blockers like prazosin. We can think about alpha 2 agonists like clonidine, and we can think about other drugs like hydralazine. These are the molecules can be used to treat this difficult to control or refractory hypertension in these patients. So we need the target BP should be less than 1 or 130/80 as per many guidelines. So BP should be kept below 130/80. It should not be reduced to that extent where the mean arterial pressure comes down less than 100. So why should we focus on the controlling hypertension that I have already mentioned? Because it has some long-term side effects. It can affect our eyes by causing hypertensive retinopathy, and it can affect our kidney by causing chronic kidney disease. It can affect our cardiovascular system by causing coronary artery disease and heart failure. It can affect our central nervous system by causing cerebrovascular accident or stroke. Not only that, hypertensive urgencies and emergencies can also be a life-threatening condition, which can be there if we don't treat hypertension from the very beginning. So hypertension is a very serious disorder that should be taken with very, very importance and should be diagnosed as early as possible so that we can treat it in a proper way and we can reduce its related complications. Thank you.